Well, welcome everyone to another delicious, nutritious adventure. This event is in collaboration with Plant-Based Nutrition Movement. My name is Carrie Bruno. I'm a pharmacist, PBNM board member, and your host for tonight's event. Plant-Based Nutrition Movement is a nonprofit organization, and our mission is to educate, inspire, and support those moving towards an evidence-based, whole, minimally processed, plant-based way of eating to improve health and quality of life at all ages. Everyone interested in health and wellness is welcome to attend these events, whether you've never heard about a plant-based diet or have already been following this way of eating for many years. We're all here to learn more and to help each other along the way. So these events are held monthly on the third Tuesday of the month, and this program is also being recorded and will be available for future viewing or sharing on the PBNM YouTube channel. If you'd like more information about this group, PBNM, and future events, or would like to become a member and receive our monthly newsletters, you can go to pbnm.org. And for tonight's event, we're going to be illustrating the life-changing benefits of living a whole food plant-based lifestyle. First, we're going to start off with a seasonal segment featuring 2 easy and delicious recipes shared by Janet Pearson. She is also a PBNM board member and a one-on-one plant-based coach. And our featured guest for the night is Dr. Akil Taher, and he'll be sharing a presentation with us about heart disease, and I'll tell you just a little bit more about that later when I introduce him. So Janet, would you like to start us off with the recipes?
I would love to. Thanks, Carrie. And what I wanted to share with everyone and not take up a lot of time, but on those days or those weeks that you have a busy schedule and you didn't have time to prep your weekend normal things, I have some 2 ideas for you to try. Salads that last in the refrigerator through the week without getting soggy. And they're a great substitute for lunch or a snack or something on the side as an appetizer. And I want to start with the chickpea salad. If you search chickpea salad, you could find thousands, hundreds or thousands of recipes. But the 3 ingredients that I learned from someone at a health club that I go to, it was just kind of mind blowing, and I kind of share it with everyone. And he said he actually didn't use chickpeas. He used kidney beans. So it could be used at this, you could use any type of bean. I like it with chickpeas since the finished product looks like more of a what I would call a chicken salad. So you just take your chickpeas, you drain them, you smash them up with a potato masher, or if you're making a bigger batch, you could put it in your food processor and just blend it a little bit, pulse it. And then you use store-bought hummus, your favorite hummus, or you can make a hummus, and you put a few spoons of that in, and that's takes the place of your mayonnaise and holds it all together. And then the seasoning, the quick and easy seasoning, is a relish. And this happens to be on Saturday. I used a sweet relish, and you could use a dill relish or any type of relish. I've even used a jalapeno spicy relish. There's all kind of flavors of relishes you could buy. And that's it. You mix those ingredients together, and that's your base. And we're going to print or post actually all the different add-ons that you could include in the recipe, like a little onion, like a little garlic, or like a little maybe some chopped up carrot, celery, normal things you would put in that type of salad. And then you could add raisins in it also. But just the basic recipe lasts for very fresh for 3 to 5 days in the refrigerator. I like to scoop it. I actually have a little in a bowl. And when I'm serving it, I sprinkle a little hot and spicy smoked paprika. Trader Joe's carries this, and it has a little blend of hot chilies in it. And it's a nice paprika. And I don't know if you could, hopefully you'll be able to see it, but this is what it looks like in a little uh, scoop. And you could use it as an appetizer on some flax crackers, or you could use it as a sandwich spread. You could put it dipped on some green salad with a little added dressing. So it's a very versatile type of recipe, and with only 3 semi-homemade ingredients that you could whip together in 5 minutes. And then my second recipe is a carrot salad. And a carrot salad also is a generational, long time salad that grandmas used to make when they had company, because they always had carrots probably in the refrigerator or their cold pan storage. And this one basically has carrots. And for the dressing, it has pineapple. And you could use any kind of pineapple. You can use crushed pineapple, pineapple tibbits. If you like it in smaller and you have the tibbits, you could just blend it in your food processor. You could keep them crunchy. You could use fresh pineapple, frozen pineapple, but the juice in the can is basically your dressing. So you mix maybe the half of the can of that with 1.5 bags of grated carrots. I like to grate them smaller so it's easy to eat, or I just pulse it in my food processor with the S-blade. You could even use baby carrots if you have those and process them, but you want small little bits of carrot. And then as an option, so those are the 2 main ingredients. You could add a little vinegar, a few spoons of either apple cider vinegar or a balsamic white vinegar, or lemon juice, lime juice. You could add pretty much anything else that you want. The other main item for a little sweetness is, if you could see it, golden raisins. I find these at Trader Joe's also. And the golden raisins tend to be a little softer and absorb the juice, the sweet juice of the pineapple. And I look for pineapple that has no sugar added. So it's just the pineapple juice. And then basically those are the ingredients. And you could add coconut if you like coconut to make it a little more of an ambrosia. You could add other fruits, oranges, and make it a fruit salad, or make it more savory by adding some cilantro or parsley or whatever you have a taste for. Or you could just make the basic and then add a little bit just each day to change it up a little bit. And then I like to top it with either some almonds or some sunflower seeds. And I like getting the raw sunflower seeds also at Trader Joe's. I'm fortunate enough to have a Trader Joe's near me. So those are my 2 basic semi-homemade, let's call them, dressing salads that you could really whip up, and they're great for company and they're great for everyday lunch. So that's my 2 wonderful recipes that I hope you all try.
Perfect. Well, thank you very much for sharing. I know we had the pleasure of taste testing those this weekend and they turned out wonderful. So I will definitely be making those soon. One of our guests also had a tip to remove the husks from the chickpeas to make for a creamier texture. So that might be another variation to give a try. So, all right. So moving on, our featured guest for tonight is Dr. Akil Taher. Now, I've had the pleasure of meeting Dr. Taher in person and hearing his incredible story. And I believe he truly exemplifies the very meaning of the word adventure. And I'm sure he'll tell us more about that during his presentation. Dr. Taher is a practicing medical doctor, an author, an eternal optimist, an explorer, an adventurer, and a strong advocate for a whole food, plant-based lifestyle. He has educated thousands to understand a way out of the pain of chronic illness and disease. And he believes that what you eat is the most essential pillar of the 6 pillars of lifestyle medicine. And he'll be sharing a presentation with us tonight describing what heart disease is, how it can be prevented, and the steps you can take to reverse it and live a healthy, long, and active life. And whatever time remains after Dr. Taher's presentation, we'll leave for questions. And everyone except the speakers will be muted throughout the presentation. And we ask everyone to remain muted to avoid interruptions and background noise. But please feel free to use the chat box for any questions that you have, and we'll address those at the end. So without further ado, let's get this event started. Welcome, Dr. Taher. We're very happy to have you with us tonight.
Thank you. Thank you so much, Carrie, for that kind and generous introduction. I am very happy to be here. I'm delighted to be here. As I said before, I could not say no because I'm flying to London tomorrow to give a talk. So I am so happy that I could be with all of you over here. Could you put me on the speaker's view now? Yeah. What we are going to talk today about is heart disease. It is the leading cause of death in the US, UK, and worldwide for both men and women, killing more people than all the cancers combined. Even at the height of COVID, this was the number one killer. But the sad part is that only 50% of men and less than 40% of women are aware that heart disease is so lethal. We got to increase this awareness amongst people. Oh, we got somebody come in. Admit. Okay. So, and we find that younger people are dying of heart attacks in their 30s, 40s, and 50s. I get a call practically one every week. People asking me that my spouse, my brother, my uncle has got a heart attack. What should we do? So let's look at the heart for a minute. A healthy heart. Always remember, a healthy heart is a very resilient organ in your body. What do I mean by resilient? It can stand and recover from most of the physiological stressors, such as physical, mental, and emotional stress. Now, think about it for a minute. The size of your heart is the size of your fist. Each day, the heart beats 100,000 times a day and pumps 2 gallons of oxygenated blood to every tissue and organ in your body. Through 50 million miles of blood vessels and arteries. So, folks, in a 75-year lifetime, say my life, I'm 76, my heart has already beaten more than 3 billion times. Incredible, isn't it? So how do we protect this heart? How do we protect this little jewel that lies in your chest cavity? For that, to understand that, we have to understand the blockages of these coronary arteries. We got to understand the workings of the coronary arteries. So let me show you the way. These are your coronaries. You have the right coronary, the left anterior descending coronary, and the one which goes behind, which is called circumflex. Now, these coronaries crown the heart. And this particular one that goes down has been called for the longest period of time as a widow maker. But folks, women die at the same rate as men. So in my opinion, this should be called a widower maker too. Because when I studied medicine in the 70s, I never thought, nobody ever taught me that. All in my textbooks it was a man's disease. So if you look at the cross section of the coronary artery, and this is not rocket science, just think about the inner lining, which is the endothelium. This endothelium produces a very powerful substance, and that is the nitric oxide. Remember this. This nitric oxide keeps your coronary artery dilated, keeps the blood flowing smoothly into the lumen, and protects the arterial wall so that it is supple and elastic, so that arteries do not get hardened and eventually causing high blood pressure, which is a silent killer. But what happens? What happens if you have rich, unhealthy food? like your standard American diet, like your fried chicken and your French fries soaked in oil and your donuts and your burgers and your pastries, cheeses and pizzas, or for that matter, the Indian diet, a junk food, vegetarian, vegan diet, full of dairy, full of oil, trans fats, salt, sugar. And mark you, the ghee that we use is clarified butter. It increases oxidized cholesterol 10 times more than regular oil. So, what really happens? Look at that in your mind, endothelium. This food destroys or damages the endothelium. So, what happens? Now come the bad actors from the shadows, the fibrin, the calcium, cholesterol, and they start damaging the endothelial and the arterial wall. And now you find them forming gooey yellow stuffed plaques that take years and decades to form. Eventually, they narrow the lumen, reduces the blood flow, and you start getting chest pain on exertion. And that is what we doctors call as angina. I want you to understand this because people should understand the difference between an angina and a heart attack. This is angina. Now, what happens with this? It takes decades to form a plaque, right? But new blood vessels start forming. These are new blood vessels which are forming, and they are actually collaterals around the heart which keep the blood flowing because they go distally to the blockage and supply the blood to the heart, so your heart is never devoid of blood flow. So there is a chance, but very, very little chance of getting a heart attack. Why do I say this? Because a heart attack is a different thing. Here you have young, friable, soft clots which rupture suddenly, forming a clot, an emboli, that suddenly blocks a certain part of the heart. This, folks, is a heart attack. And 50% of the people die with the first heart attack. So what happens in this case? It's an emergency. You go rush to the emergency room, they do your EKG, they do your blood work, they find out that they take you up to the cath lab, and boom, 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 the clots are removed. They put in stents, and if the stents fail, they do open heart bypass surgery. So understand, angina, heart attack. What happened to me? I am a heart disease survivor, but I had angina. My plaques were large, thick, containing calcium, scar tissue, and sturdier, unlikely to break and cause heart attacks. Two of my arteries were 98 to 99% blocked, but I did not get a heart attack. What happens? Now, large international study from the New York University and Stanford, they said that invasive procedures are no better than diet, medication, and lifestyle changes, even in severe but stable heart disease. And Dr. John Cook from Stanford went one step ahead and said 50% of stents, angioplasties, bypass surgeries done in the USA and probably all around the world are unnecessary and should be only done in emergencies like a heart attack or when medications, lifestyle changes, and diet fail. Now, those who have angina and those who have suffered a heart attack, I am not asking you to follow this. You'll go to your cardiologist, but ask them, is there an option for me? Because there is an option. And this is where Dr. Esselstyn comes in. Everybody, most of you may have seen this. This is one of Dr. Esselstyn, the pioneer in whole food plant-based. His colleague, a surgeon. This surgeon apparently was having multiple vessel disease, was having comorbidities like crazy. And so he was not a candidate for surgery. And therefore, he was put on a whole food, plant-based, no sugar, oil, or salt diet. Look at his coronary. Prior to that, moth-eaten, narrowed down. And after 3 years, no surgery, no stents. And look what happened to his coronary. And now recently, there is Dr. Ornish's observational study, the power of whole food plant-based diet, 35%, 35 patients with severe heart failure, meaning that their ejection fraction was very, very low, the pumping action of the heart. And so they were all waiting for heart transplants. They were all put on whole food plant-based diet, no sugar, no oil, salt. And guess what happened? All of them improved the quality of life, and 5 of them did not need surgery. So this is what it is all about. Anyway, after saying this, I come to my story. I am a physician, but I am also a heart disease survivor. So I understand what people are going through. Till the age of 61, I was a creator of my own unhealthy lifestyle. I spent most of my adult life eating unhealthy, rich food without worrying about what effect it would have on my body. And I was called a seafood eater. SEE. I ate everything at sight. And I was working hard, long hours, hardly getting any sleep, 4 to 5 hours of sleep at night max. And when I was not eating, or when I was not actually working, I was a complete, okay. So if I was not eating or I was not working, I was a complete couch potato, meaning that I did not know the meaning of exercise. Oh, sorry, I stand corrected. I did exercise my hand muscles, holding the remote to change the TV channels. That's what I did. And my family history was not too good either. My brother tragically died at the age of 52 of a stroke. Both my mother and sister succumbed to heart disease at the age of 69. But remember that genetics plays only 15 to 20% of your health outcome. And that too can be negated or mitigated by your lifestyle changes, the epigenetics. So don't blame your genetics. I've had bad genetics. I'm doing the best I can. So all this eating and not sleeping and working and not exercising led to a lot of stress, a stress that I could not handle. So I was not surprised that heart disease came knocking at a young age of 56. And I had to have stents. Now, as I told you before, my plaques were very thick. So they had to use a diamond tip cutter to shave off my plaques. And in the process, I got a cardiac arrest. My heart stopped. My first encounter with death. But that is not shocking. You know what is really shocking? Is a brilliant cardiologist who saved my life that day. He died of a massive heart attack while he was on his treadmill 2 years after he saved me of a massive heart attack. And you know what his age was? 48 years old. So now people are thinking, the viewers are thinking, now Dr. Taher must have changed his life. Got his stance and all that. Nope, not a bit. I continued my same erratic, unhealthy lifestyle. It had not hit me. And so my stance failed after 5 years, and I had to have an open heart bypass surgery. Mark my words, I will do a half marathon in a year's time if all goes well. This is what I told the nurses in the ICU. I don't know why I said that at that time. But looking back, I believe that I had only two choices left. Either to continue this horrendous, horrific lifestyle, or to make a conscious decision to start living with purpose, with passion, with positivity. And I chose the latter. So my recovery was remarkable. I was on the treadmill on the very third day. I started eating better. I started exercising. I started meditating. The spirituality came in. The yoga came in, the breathing exercises. So in 7 months, I kept my promise and I did my first marathon in Nashville, Tennessee, 4 grueling hours, but my bruised heart did not fail me. Just 4 months after that, I circumvented Mount Kailash 19,000 feet on foot without oxygen. Then I did several marathons, half marathons, triathlons, and then I did a 100-mile bike ride and bungee jumping and whatnot, amongst many other things. So I was still wondering. I was doing all these things, but I was still getting illnesses. I forgot to mention that I also had severe diverticulitis. Why? Because there's no fiber in my diet. And that diverticulitis, people who don't know, they're little pockets in your colon. And when they get inflamed and infected, they can perforate. I had 2 perforations, and my surgeon, my friend, who stands above me and says, Akil, if I don't take you in for surgery right now, you may die. So I was wondering, so I started researching on ways to heal the body without solely relying on medication and invasive surgery. The more I read, the more I realized was something here. That is when I came to realize the 6 pillars of lifestyle medicine. Nutrition being the cornerstone, complemented by your exercise, your sleep. I got only 4 to 5 hours. Manage your stress, avoid risky, abusive substances, and social relationships. Now, folks, remember one thing. The 6 pillars are like a symphony orchestra. You see, they all have to, the trumpeter, the pianist, the saxophone player, the cello player, they all have to play in sync to get a harmonious sound pleasant to the ear. Similarly, the 6 pillars are interconnected. They help each other and have to work in harmony to produce the best health outcome. I know my patients, my friends, my family will tell me, oh, but we are eating a good diet and we're exercising. Great, superb. But do the other things that will help you in the long run to give you the best health outcome. So let's take the first one. Whole food, plant-based diet. Increase half your plate should be fruits and vegetables, 1/4 should be grains, You all know this. Your one food should be your beans and lentils, and then your nuts and seeds. Remember, it is not bad genes that run in the family, but a bad diet. What should you do? Look at labels. If you cannot pronounce something, don't buy it. Avoid processed foods, sugar, cut back on salt. You know how much an average American has sugar? 16 teaspoonfuls of sugar. Processed sugar. What about salt? 3.5 grams of salt we are having. And the American Heart Association says 2.5. I say 1.5 to 1 gram. Avoid junk vegetarian vegan food. Reduce your bad cholesterol. Cut back or stop eating meats and saturated fats. Avoid dairy products. You know what Rip Esselstyn said? Dairy is liquid meat. A cup of milk has the same saturated fats and cholesterol as an ounce of meat. And then, of course, avoid trans fats. Your vegetable oils are chemically altered to stay solid at room temperature. Your coconut oil, your palm oil, your ghee, your clarified butter. And the most important statement about foods which I can make around today is diet in America is a leading cause of chronic disease, disability, and death, not in the US, in the Western world. And when I talk about the diet, people often ask me questions about these few things. Fiber. Fiber is so great. I mean, you are supposed to have 38 grams of fiber. An average American has 15 to 20 grams of fiber. I believe you should have 60 grams of fiber. It's a prebiotic, and therefore it can improve your gut bacteria. It prevents, it lowers your cholesterol, prevents constipation, and the complications of constipation, like diverticulitis, which I had. Number two, B12. Have the B12. Vegan and vegetarians, you should have. But I think everybody should have, especially older people, because there are so many medications that they have, their absorption of B12 is not there. B12 was good in the soils when we had the rich soil. Now with insecticides and pesticides, we have destroyed the B12. Calcium, overrated. The dairy industry wants you to have 1.5 grams or 1 gram of calcium. All you need is 600 grams of calcium, and that you get from your cruciferous vegetables like your kale, your collard green, your spinach, your almonds, your pumpkin seeds. And so there is enough calcium. You don't need to go for dairy products. Vitamin D, another important point. I believe everybody should be on vitamin D, the sunshine vitamin. You know, during the COVID period, even before the COVID period, 60% of nursing home patients in America were vitamin D deficient before that. And when the COVID was the first 2-3 months when I was totally at home, my vitamin D level fell down to 3. So 30 to 100 is your normal. So please, vitamin D improves your skeletal health so that in old age you don't get those horrific hip fractures, which cost the taxpayer billions of dollars. Number two, it helps in the absorption of the calcium that you are taking. And vitamin D, if you are in a sunny place, then go around from 10 a.m. to 3 p.m., go out for 15 to 20 minutes, and you will get enough vitamin D. That vitamin D from the sun is absorbed and it remains longer in your body than supplement. But if you can't do that for whatever reason, take supplement, vitamin D. But it is extremely important. Oh, by the way, even during the height of COVID, there was a small study done, 50 patients, and 25 of them, all of them were admitted to the hospital in the height of COVID. And they were admitted to the hospital, and 25 of them were given very high doses of vitamin D, 50,000 units, and the 25 were not given. And from the 25 that were not given vitamin D, 7 of them landed up on a ventilator, while only one person from the vitamin D group landed up on a ventilator. So that's important. Protein. Everybody says, of course, when you get older, your protein, your muscle mass is going to decrease. Don't run around and start getting protein and shakes and powders. It's not worth it. Your muscle mass decreases because of hormonal changes, your inactivity. And so you have to increase muscle strengthening exercises, and you will not need any protein powders. And remember, animal protein has a lot of problems. We can talk about it some other day, but animal protein has a lot of problems. So plant protein is a way to go. Okay, next thing, physical activity. Now here, any amount of physical activity is better than none. Okay, I said that. But it is important that adults engage in both general physical activity as well as purposeful exercise. I will explain to you. General physical activity is when you do your gardening, or you go out for a walk in the park, or you play golf. These will burn your calories, increase your endorphins, you start feeling better, and prevents you from getting stiff and rigid, especially the males. So that's a good thing. But if you are thinking of some kind of a health outcome, you want to reduce your blood pressure, you want to reduce your weight, you want to improve your endothelial function, the one which produces nitric oxide, you want to increase your good cholesterol, improve your insulin action, reduce your risk of cardiovascular disease, then you have to do moderate intensity exercise at least 30 minutes a day for 5 days in a week. And you should get your heart rate to 70% of your maximum. Now, folks, you'll ask me, what is your maximum heart rate? So take me, for example, 220. Just remember the number 220. 220 minus your age will give you a maximum heart rate. So my maximum heart rate is 220 minus 76 will be about 145, 146, whatever. 70% of that is 102, 103. If I am exercising for 30 minutes, at least for 15 minutes, 20 minutes, 12 minutes, my heart rate should go up that high for purposeful exercise. If you do that, then in the long run, you'll find out after 2-3 years doing a regular exercise, purposeful, your heart rate decreases. If it was 73, now it is 64. So your heart has to do less work, and your muscles can pull out more oxygen into the blood, from the blood. So it decreases your resting heart rate in the long run. And it also reduces the time for your resting heart to normal after moderate intensity exercise. Meaning that if I've exercised and my heart rate has gone to 107, 110, my age, then you should see how long it takes for it to come back normal. If it takes a long time, it's not good. That's another advantage. And the recent research, not the latest, is that the exerkines, these are released after exercise into the systemic circulation and can enhance vascularization, new blood formation, endothelial functions, improves your blood pressure, and it helps the skeletal muscles, muscle formation, helps in the repair, and it helps the pancreas for more insulin secretion. So exercise is a must. Now, the third thing is sleep. This is phenomenal. Sleep is your superpower, a non-negotiable biological necessity. Sleep is not the absence of wakefulness. Sleep is an active state of rest when your brain is doing wonderful things, impact on your learning, your memory, your immune system. The recommended this thing is 7 to 9 hours of nightly sleep. Effects of routinely sleeping less than 6 hours a night can be detrimental to your health. And you know what it is? A Japanese study was done for 14 years in which they found that people who slept routinely slept 6 hours a night, they had 4 times more chances of getting high blood pressure and sudden cardiac death. And now, what I'm about to tell you is mind-blowing. Just 1 hour. This is a global experiment on lack of sleep. A global experiment done in 70 countries, 1.5 billion people, and what is it? It is a daylight savings. So in spring, when you lose an hour, what they found was that there were 24% increase in heart attacks the very next day. And in autumn, when you saved an hour, there was a reduction of heart attack by 21% the next day. And the same thing was for suicides and car accidents. Incredible. Sleep is a must. Now, suggestions to help you sleep better. Go to bed when you're sleepy. What is the analogy? Do you go to the dining table and sit down to wait to get hungry? No. Why should you wait to get sleepy? Go to bed when you're sleepy. Only use the bed for sleep and sex, not necessarily in that order, but anyway, no distractions, no computers, no phones, no messaging. If you can't fall asleep within 15 to 20 minutes, leave the bedroom, go outside, have a massage or read something or meditate or listen to music. Then when you're sleepy, come back to the bedroom. Sleep and get up at the same time. Your sleeping long time on weekends is not going to make up for the lost time on weekdays. Keep an alarm clock, but not to wake you up, but to set up a time to go to sleep. And keep the room 65. Your body needs to drop its core temperature by 2 to 3 degrees to initiate sleep. So a warm, hot water bath, and then come out, keep 65 degrees, and you will start the initiation of sleep. By the way, I have improved my sleep. Not much, but I'm getting there. So that is sleep. Next is your stress management. Now, what is it? 2 types of stress, acute and chronic. What is your acute stress? If somebody who is trying to snatch your purse, what happens? Your blood pressure goes up, your heart rate goes up, you start breathing heavy. This is like putting your foot on the gas pedal. Once the event is over, your foot goes onto the brakes. Everything comes back to normal. This is your fight or flight. This is normal for everybody. That's acute. But if this sympathetic system, overstimulation of the sympathetic nervous system continues in your life, then you get chronic stress, where your cortisol goes high and you start eating more and then you start getting obese and then you get sleep apnea and whatnot. What is chronic stress? It's a state of worry caused by what? By a difficult situation. Remember the chronic stress, the 4Ds. Why do people get stressed? They're heavily in debt, divorce, disease, or death. So when you are faced with this, try to help out. Do something else to keep your mind occupied by helping other people. Get help with crutches like meditation, yoga, breathing exercises, even help with psychotherapists and psychologists and all that. That's fine. But stress can bring you down. Then you come across avoiding abusive substances. Look at what fentanyl has done, the epidemic. Cocaine, amphetamine. I mean, your pain medications, your Oxycontin, hydrocodone, all these which are given for short period of time, people get hooked on it. And I've seen people using it for years and years and years. But my greater this thing is, look at people who use over the counter, like ibuprofen. I saw a patient about a month back who came to me having 600 milligrams of ibuprofen 3 times a day of ibuprofen for the last 25 years. He came with an ulcer, with a heart problem, and his kidneys failing. Same thing with your Tylenol. If you go on taking it, it is going to affect your liver. That is my worry. Over-the-counter medications too. And a word about alcohol. If you're not drinking, don't drink. If you are drinking for health reason, for getting your good cholesterol high, forget it. It does not help you at all. Physically, no help of health. But if you are going to drink responsibly, glass of wine now and then, I am not here to stop you. And smoking, everybody knows. A caution to youngsters, because they forget to realize that that shisha smoking, that hookah, it has tobacco. And some youngsters have come to me and said, we didn't know that. So be careful about that. And then finally, you have the social support. I mean, most of you must be knowing about the blue zones. These blue zones are there in several parts of the world. One of them is in California, Costa Rica, one in Italy, one in Okinawa. And all these people live a long, healthy life. Not a long life, but a long, healthy life. And what they found was the tenet of the blue zones was mainly eating a plant-based, well, not totally, mainly eating a plant-based diet, eating to 80% full, and they were extremely active. But more than that, they had a strong social bond. You see, this bond whereby they actually shared each other's experience. They related to each other, they helped each other, and they sort of helped each other with exercise, with stress. They played games too. And what I found was that it reduced the stress and anxiety and lowered the blood pressure and improves heart health. So those are the 6 pillars of lifestyle medicine. And just to bring you up to date, let me tell you a few new breakthroughs in the war on heart disease, if you all don't know about it. First is intravascular lithotripsy. Everybody has heard about the lithotripsy for kidney stones. This is similar. It breaks down the heart plaques. I don't believe in this. Why? Because I don't believe that heart plaques should, because they will not cause heart attack. Again, I repeat, ask your cardiologist for options, but listen to him. or her. Your cholesterol smashing drugs, Repeta, I forgot to mention to you, or I did not mention to you, I also have a conduction defect in my heart, which is called a Wolff Parkinson White syndrome. This is like a horror movie, but it is a conduction defect where my heart can go beating very fast. I also have people should check it if they've got aortic valve problems or the cholesterols are not coming down at all, then they should get their LP little a checked. Lipoprotein A. My lipoprotein A, my cholesterol was very high. It would not come down. I checked it and it was way, way, way high. It's genetic. There's no treatment right now, but cholesterol smashing drugs can help, like your Repatha. Biodegradable stents, I love that because they only remain in your body till your lifestyle and medicine takes over, and then it sort of is absorbed. And finally, you have clearly, Cleerly. This is artificial intelligence, AI, which on coronary computed tomography and angiography, what they do, clearly the AI, they actually look at the plaques and figure out how much of plaque it is in the coronaries and whether it is soft and friable that can break and cause a heart attack, or it is hard and sturdy and will not break. This is not done in all the centers, but I know a few of my patients who got it done. One had to go to New York to get it done. Now, also regarding the LP little a, you must your cardiologist will not tell you. It is not a routine test, but you have to ask for it. If you are a South Asian, ask for it because we have much more of this than others. So having said that, I think I am right on time. It is almost 44 minutes. So I will entertain questions now. And I'll stop sharing for a minute. I hope you'll all enjoy this. Thank you very, very much.
Thank you very much, Dr. Taher. I really enjoyed that presentation. If anyone has any questions, feel free to add it to the chat and we will go ahead and read those. But I guess I'll start with a question. So you mentioned that, when you first had your bypass, after that, you really didn't change much diet-wise. I guess what was the second time around, what was the reasoning, or I guess how did you go about it? I mean, did you know anybody at that point that was eating this way, or how did you happen upon plant-based eating, or what made it stick that time?
See, let me tell you this way, Carrie. Adversity can bring the best in you
Mm-hmm.
or the worst in you. After tense, or the worst, I was severely depressed. I was having a lot of problems, and I increased my diet and bad diet. But adversity after my open heart surgery really worked for me. As I said, I started reading. I started figuring out ways to heal the body without just relying on medication and surgery. That's
Mm-hmm.
the time when I saw the movies like Fork Over Knives, and I met these people in person, Dr. Dean Ornish, and I talked to him, and then I talked to Esselstyn. So this is when I started doing my research. I came across a feeling that, look, I have no other choice. Most of the time, everybody feels that if you have got a bypass surgery or stents, you're cured because the immediate results are great. You feel great. So you feel I'm cured. But they don't realize that it can happen in your brain and you can get a stroke. It can happen in your leg, you can get claudication. It can happen in your kidney will fail. because there's millions of arteries in your body. They all have this. So I think that I was at the dead end. I didn't know what to do. So I tried to read these things and talk about it. I went to seminars.
Mhm.
I got certain things out of that. Game Changers, I read. That got me into the sports activities. And I didn't want to just survive, I wanted to thrive. And I'm doing it right now. Longevity is not my problem, quality is my problem. And as far as my quality of life is reasonably okay, I'm fine. And I want you people, whatever you heard today, spread the word around. Talk to people that uh, uh, age, old age rather, is not a limiting factor for people to change their lifestyle. I did it at 61. People have done it at 70. People have done it at 80. So go ahead, take baby steps, but get your exercise involved. That's what I'm doing. Even my book, Open Heart, read my book. All the royalties are going to Peter and St. Jude's. I want you to read that. I want you to, if you don't like it, give me a bad review, but give. I don't care. But read it.
Yes.
So I hope I answered your question, Carrie.
Yes, you did. And we actually have some more questions from
Sure.
members in the chat. So please repeat what test you told at the end for South Asians.
It is LP little a, lipoprotein A. If you have got some very strong history of heart disease, your cholesterol is just not coming down, you've got aortic valve problems, get your LP little a. Or even if you are just a South Asian descent, and when I say South Asian, I mean people from Pakistan, India, Nepal, and Sri Lanka, as far as Bhutan and Maldives. There is a separate thing that I can go on talking about South Asians and heart disease. We, American Heart Association, has said that being a South Asian like me, it is an independent risk factor apart from high blood pressure and diabetes and other things. Just being a South Asian, I'm more likely to get heart disease than others.
Okay, and then also that same person wants to know a little bit more about the calcium score and how helpful it is in deciding your heart health.
See, what I would say is, the 400 and above calcium scores are very high. Then there is difference in the lab readings of calcium scores. But a calcium scan should be done by people, say, who is in 40s, has got no blood pressure, got no diabetes, no high cholesterol, but got a very strong family history. Get a calcium scan done. But the scoring and all that is lab to lab. Get the scores done. If your scores are there, but now we do a lot of other tests also. So, but depend on the calcium score. If it is too high, 300, 400, then you should be worried about it. And another thing is that even if you got calcium, high calcium, and your cholesterol, if you do a whole food plant-based diet, the people have always asked me, will my calcium dissipate? Not necessarily. Say, here is your artery, and you have a calcium around here. That calcium may still be there, but your coronary artery will dilate. So it will find ways, or the blood will find ways to move through the artery. And some people have also told me that if our cholesterol just does not go down for whatever reason, I've tried everything and it doesn't go down. But if you are on a whole food plant-based SOS diet, don't worry about it because your endothelium is healthy. If your endothelium is healthy, you're getting nice nitric oxide. So your cholesterol will just move around.
Nice clarification. Another question. Is a baby aspirin, this is from Janet, is a baby aspirin still recommended daily? My mom is 90, takes one a day, and she's only on one other medication for irregular heartbeat, and she's active and fit on a whole food plant-based diet.
If she has an irregular heartbeat, you said, right?
Correct.
Irregular heartbeat, now I don't really know the history,
Mhm.
but just to tell you, if it's an atrial fibrillation, then you need a blood thinner. So in that case, because of no clots forming.
Mhm.
But if you're a healthy person and you're on a good whole food plant-based diet, I don't think a baby aspirin is required.
Okay.
Because
And
it
then,
can cause ulcers and other things,
yeah, other complications for sure.
And you should know, Kerry, you're a pharmacist.
I do, yes. So the next question is avocado oil and olive oil still healthy to use for cooking and dressings?
This is unsaturated, monounsaturated, and fatty acids. Now, I am not that person to tell you no oil, sugar, salt diet. If you are using sparingly, just to saute something or just spray bottle, I would not stop you if you don't have a problem. But if you have a heart problem, if you've got some heart disease, then it is a must. But ideally, you should not. But then, we're not living in an ideal world. So I have a lot of people who turn around and say that I do everything else, but I just need to spray a little bit here and there. I don't stop them. But if you can get away with it, do it.
Mhm. Yeah,
But it's unsaturated. Mono and unsaturated, polyunsaturated fats are, of course, better than your Crisco and your palm oil and all that.
yeah, for sure.
Avocado oil, same thing.
Yeah. And then what is your opinion on getting enough iron on a plant-based diet since non-heme iron bioavailability is much lower?
You see, again, your iron is based on your lab results. Are you anemic? If you're anemic, then we've got to find out the cause of your anemia. In when I practiced in 70s in India, there were a lot of people anemic. It was nutritional. But here it is not nutritional. If it is you're anemic and you need iron, there is a cause for it. Either you're slowly bleeding somewhere, you're going to bleed, and you're going to find out all that. Once you find out that, then we can address the situation. But even if your absorption is it is less harmful than heme iron. And you don't need it if your hemoglobin is say 14. Then what is the sense? You can have a slow absorbing, which is not going to hurt you. Then to heme iron, no. Sorry, I would definitely say no heme iron.
And then one other question that I have, and maybe some others might have as well, how can others get a hold of you or where would they go if they want to learn more about you or reach you?
Run a marathon with me.
Great idea.
You got to laugh loud, live lots, and whatnot. But anyway, I I am available on if you go to akiltaher.com,
Okay,
taher.com, you will have all the things to get in touch with me.
perfect. And we will make sure to put that website in the show notes of the recording so people have access to that. And then one last question, have you encountered children with cardiovascular disease in your practice?
I have not had coronary artery disease, coronary heart disease, but with valvular problems, Those kind of things I've noticed, and I've sent them to the pediatrics because I'm a family physician who does pediatrics so I don't, but I haven't really seen in practice. But atherosclerosis starts at the age of 8 to 10,
Mhm.
my grandson's age. So be careful about that, you know. No, I have not.
Yeah. Well, it's good that you haven't, but yeah, like you said, it starts young. So the earlier you can make these nutrition changes, the better, for
And for
sure.
the South Asians, remember, the South Asians, uh, I'm going to talk tomorrow in London, no, day after. But what I'm saying is that the children, the second generation South Asians who are living here in US or UK, they may be exercising much more than the first generations like us. So there is no problem in exercising. But if they go with the peers and have a standard American diet and come home in the evening and have a junk food vegetarian diet at home, it's a double whammy.
Mhm.
It's dynamite. So I've seen a lot of those children who are insulin resistant, even though they don't have high sugar, they don't have high blood pressure, they don't have anything, but they're insulin resistant. Because what does insulin do? It, people make this mistake that sugar causes diabetes.
Mhm.
Sugar does not cause diabetes. It is an end result of diabetes. What causes diabetes is your fat in your muscle cell, because as insulin brings the sugar into your muscle cell to be used as energy. But if your fat cell is blocking that, the sugar goes outside into the blood, brings up the blood sugar. So now when your blood sugar is high, now if you take whether it is fruits or it is sugary drinks, your sugar is going to get high. There's no place to go. The fat cells have stopped it. And we have more of insulin resistant in South Asians because smaller coronaries that can block very easily.
Yeah, very important clarification to make. A lot of people, yeah, and I think I was surprised to learn that too. Coming out of pharmacy school, of course, that's what they teach you is sugar and diabetes
I was
don't go
taught the same
together.
thing,
But
Eric.
yeah, I know, and it's surprising to hear it the other way around. And I wish more people would understand that connection.
I wish I could come around one of these later on in a year, talk about diabetes,
Hmm.
type 2 diabetes. Simple this thing, and it is an eye opener.
Yeah, for sure. Going back to cholesterol and the LPA test you mentioned, we had a viewer saying, I have good LDL, which is around 70, but LPA is in the high risk area. What would you do with that?
I just read some new reports that have come out, which are showing how to decrease LPA. But if your cholesterol, total cholesterol, your LDL, and your HDL are all normal, don't worry about it. Just follow whole food plant-based diet.
Okay.
But it is in the horizon. It is coming very soon, you know. But now, unlike that person who said this, take that person and me. Now, my cholesterol is very high and it wouldn't go down. And I got an heart disease at a young age, possibly because of LP little a, but nobody checked it. So for me, I have to bring it down. So I have shots of Repatha. To bring my cholesterol down. It was very high otherwise. And on
Okay.
a plant base.
Interesting. Um, what is the best non-invasive test for judging the heart artery blockage or condition of the heart for age group 50 to 60? It's another question.
Non-invasive would be now your cardiac scans and your calcium scans and all that are your best bets right now. Uh, but actually, a stress test
Mhm.
that can tell you a lot. If you can't keep up the 9 minutes Bruce protocol, then they can give you a chemical test. But get a stress test done. And if you're reasonably fit, you can do the 9 minutes. They'll immediately find out if there is. It's not a gold standard by any chance.
Yeah.
That is positive, then go in for the coronary tomography and the test that we talked about, CCTA. You can do that, and then ultimately go in for angiograms. Now, again, I'm not saying that you should do it, but I would have done it differently. Is what happens is that when you are when you have this chest discomfort and your stress test is positive and they do an angiogram, when they find a blockage, they immediately put the stents in. But I personally believe that if there is not a big, huge blockage or anything like that, don't put the stents. Give the patient an option. Tell them to go to a cardiologist who believes in whole food, plant based diet. Go and give that option to him. If he doesn't want it, that's fine. Put a stent, do a bypass. But trust me, when they open your chest, it's horrendous.
Mhm.
I mean, each cough makes you want to just freeze.
Yeah, no, I obviously have not been in that position, but I see it a lot. And once you have those procedures done, there's a lot of complications that can come from it. And so if you don't have to go that route, it's so much better.
Very true.
Um, yeah. We have a couple people asking if you do practice telehealth anywhere in Illinois, maybe.
I am trying to right now I'm doing telemedicine for the patients in my own clinics back in Alabama. Uh, I go there once in a one weekend in a month just because they want to see me and I want to see them, to be
Mhm.
very honest. Nothing much. But telemedicine per se, no. But I would not, if somebody wants advice and text me and then talk to me,
Mhm.
I'm open to that. If it's a
Okay.
real question, I'm open to it.
Very good to hear.
But don't telemedicine me and ask me, oh, I only got 5 hours of sleep. Am I going to get a heart attack? No, no, you're not. But it was
Um,
lovely talking to all of you. I was so happy. Kerry, you did a brilliant thing about organizing this.
Well, thank you. I appreciate. I've heard your story before, and it never gets old. I enjoy hearing about it every single time. I guess one last question I'll ask to wrap things up. So you are very, very active these days, running marathons and so many other things that I can't even begin to state them all. But what's on the horizon next? What's your next activity that you have planned?
Uh, You see, I've stopped long distance running. I
Mhm.
mean, as you get older, you do get problems.
Yeah.
And I had a herniated disc in the right side. So, of course, there were some of the orthopedics were very knife happy and wanted to cut me. And I said no. And I did physical therapy and it has all got better. But I do a lot of 5Ks
Mhm.
and sometimes I do 10Ks. Uh, right in the on the horizon is I wanted people, older people, to realize that you can still be active and do things. So I am having a story about me, video this thing where they will video me doing my runs, my bikes, my swimming, And so that can go as a platform to people that look, if this old person doing this, why can't we do it? So on the horizon, I have my whole family come to Atlanta to do a 10K in August. Some of them have not even done 1K.
Yeah,
So anybody wants to join me in August.
sounds good. We may have people take you up on that. You never know. All right, well, I think that's all the questions that we have. So thank you so much, Dr. Taher. It was so much fun to have you. And thanks to everyone else that is either here live or who's going to be watching the recording. Be sure to check out the show notes. We will include all of Dr. Taher's information and the recipes that Janet shared earlier. So be sure to check those out. And before we say goodbye, I'll tell you about our program for next month. We are very excited to welcome Vicki Brett Gock as our guest speaker, and she's going to be demonstrating 2 delicious recipes, a hummus and a spicy roasted cauliflower. You'll definitely not want to miss that one. And the date for that event is in May. It will be Tuesday, the 21st. And we hope to see everyone back and bring a friend with you. So,
I just want to thank Janet for those recipes. I'll try them out.
yes. Thank you, Janet, for those. All right. Well, have a good night, everyone. Thank
Love
you
all
for
of you.
joining.